How are we all looking there? All right. Thank you, Caesar. I really appreciate this absolute honor. I am all about women empowerment, and this is just such a fantastic opportunity today to talk about something that I am so passionate about: dentistry, leadership, and purpose with a fantastic charity called Better Lives Foundation. I just want to thank you all today for joining us, and I really hope that my heartfelt enriching journey for me inspires you to not only be inspired, but also be inspired to join our community that really wants to make a difference. So, what will I be sharing today with you? I'm going to be talking about the tremendous journey Better Lives Foundation has made. I'm going to be talking about the dental department, the evolution of multitude of dental camps, stories from the field, and how we want to progress to making dentistry sustainable. And of course, the power and purpose in dentistry and how you can really get involved. Because let's face it, we are a family on this planet, and when we come together, we can make so many beautiful things happen. And today's presentation is going to show you exactly what happens when community comes together. Now, I don't know about you, before I go on to discussing and sharing BLF's journey, I wanted to share my own because I love to know the why behind. The why behind that something that motivates others. And I am blessed to have the opportunity to have had the privilege of having education. And education is a privilege. It is not something that is always accessible to everyone. I had my struggles, but I can proudly be here today and tell you after obtaining 2 degrees as a physiologist, as a dental surgeon, and having the honor of being recognized for something I'm very passionate about, which is treating nervous patients at the Private Dentistry Awards. But nothing gives me more joy than what my skill set has allowed me to do, which is to connect human to human and do humanitarian work where it really matters the most. So I'm going to share with you my why because this is so important. Despite my challenges, and when I say challenges, I know this month has been difficult for so many who have gone through their A levels, maybe didn't get the grades and their GCSEs. It's been a tough month for parents. But I was that child. I was that child who after now obtaining 2 degrees, two postgraduate diplomas, I was that child who, despite having offers in medical school, life happened. But do not let your grades define you. Be determined because you will achieve. And my why is because of these amazing people in my life. I was inspired from a very, very young age by having amazing role models. My mom, Mommy Sisodia, and my dad, Daddy Sisodia, these two have been just enriching my life. My mom came from India. She was a graduate in accountancy, and she was one of the first women in her village to obtain that degree. And when she came here, I still remember, moving into a country, learning the language. I remember doing my GCSEs and she was doing them as well. And she instilled the value of education, hard work, and a sense of purpose. I still remember going with her and her friends to a homeless charity along with the church and the organization called the Sri Sathya Sai organization. We would go to soup kitchens and feed the homeless. The community would come together. And that sense of purpose and community enriched my life. I wanted to be somebody who was purposeful with what I achieved. And despite my challenges and my opportunities, I realized it takes a village to raise a child. So I thank my village, but I also want to be that village that encourages, that nurtures. And after 18 years, this was 18 years of a dream for me where I wanted to be a healthcare professional making a difference at large. My first medical camp was back in 2007. And in 2007, I was in Malawi as a graduate in physiology. And I met amazing individuals who showed me how it was to lead with compassion, to lead with compassion, and how it was to really be on the field. And that was so, so important because they were my role models. And after which I joined multitude of medical and dental camps, which shaped me to be the person that I am today. Struggles, challenges, they all are but an opportunity. And that is what Better Lives Foundation is about. And on my journey, I came to know about them. So Better Lives Foundation, I would like to introduce here our CEOs, Raj and Devi Patel. They have been doing global missions since 1981, before I was even born. And their journey started in Sierra Leone in 2006 with Better Lives. This is how Better Lives Foundation started. So Sierra Leone, for those of you who don't know, is in West Africa. It's got a population of 8.8 million. And the Yonibana Sai Hospital, which is now existing, is in Yonibana, which is 91 miles away from Freetown, which is the capital. So if you are residing in Yonibana at that time before this hospital, the nearest facility was 91 miles away, if you can imagine. So where did it start? How did it start? The medical camp in 2006 was the game changer. This was the eye-opener. They set a camp in a secondary school. And on the second day of camp, with volunteers of medics, dentists, healthcare professionals, on the second day of camp, there was a lorry overturned and it was an army lorry that was transporting people illegally. But a huge accident had happened. They must have heard about the medical camp. And as they heard about the medical camp, they literally dumped these people on the entrance of the medical camp. People had broken limbs, they were bleeding. And as people were offloaded carelessly, there was a baby that just did not make it. This camp showed them that there was a need for sustainable healthcare and infrastructure. Because had it not been for that medical camp, those people on that lorry that day would not have made it. So you can imagine when something like this you experience with your own eyes, you have two solutions, two things you can say. Well, that was so sad to see. I'm glad we were there. What shall we do now? Should we plan the next medical camp somewhere else? Or shall we make something that's going to be sustainable? In a developing country, you can imagine that this is a huge challenge. So a lot of people often ask me, well, why Sierra Leone? Sierra Leone has the third highest infant mortality rate in the world. Providing surgical care is just paramount in improving the situation. The deep-rooted poverty means individuals and families cannot pay for day-to-day medications or life-saving treatments. At this moment, we are the only hospital in Sierra Leone that provides free treatment to anyone who walks through the door. So our aim is to offer free, high-quality medical care to those in need, supporting their education for healthcare and independence and self-sufficiency. We all know self-sustaining healthcare and infrastructure is what we need for the long term. And we take for granted just having running water and clean water, but in some areas, gosh, this is a real gift. So if I was to say to you on this barren land, back then, there was a dream, there was a vision. We're going to build a hospital. I can only imagine the doubts that would creep up in our minds. It's only human, right? 2007, a barren land was purchased. 2008, construction began, and it became fully operational the next year. This is now Yonibana Sai Hospital, the only free running hospital in the country. And I'm so proud to share that with you. In this hospital, in the existing infrastructure at the hospital, we have power, water, and that sounds so simple, but this is 91 miles away from the capital. This is in the middle of almost nowhere. And here we are able to have an operating theatre, a ward, a pharmacy, consultation rooms, a dental department, and a maternity ward. Our organization is made up of consultants and specialists, and I'm so proud to be able to work with these amazing souls here in the UK and there in Sierra Leone. This is our staff in Sierra Leone. And for them, this is really a lifeline because Better Lives Foundation has sponsored their education from secondary level to graduate level for medical and non-medical training. But this has meant they are able to not only give back to their own community, but they're able to self sustain themselves, their family, their loved ones. This is a lifeline. And 2025, where are we now? I'm not even going to say a word. I want you to take this in. Just take a moment to take the statistics of what it has achieved in all these years. To date, we have been able to treat over 115,000 patients. And it's been such an honor to be part of this mission, to be part of this journey. And as a dentist, I was so honored on the multiple camps that we've been able to treat so many. We have done over 10,000 dental extractions over our time. But every time I come back from a dental camp, you would think I would feel coming back so happy. I don't, though. I come back thinking, I've got to do more. What's happening with my patient that I treated that week, that little boy, that little girl, you know? And it stays with me. It really stays with me. And when we put into context where we are with dentistry in the UK, we have a population of approximately 69 million. And on our GDC register at the moment, we have 45,000 plus dentists. And that just doesn't seem enough still. But let me share with you the statistics of Sierra Leone. In a population of just under 9 million, we have 10 to 15 dentists registered. Can you imagine? Can you imagine having pain and not having a facility to go to? And this is where we come in. This is where Better Lives, and I hope those who are listening today, where we come in, because we can together create something that's going to be sustainable. So somebody doesn't have to go all the way to Freetown, all the way 91 miles. Because remember, we are serving in Yonibana when we are there as dental professionals serving. But in between that time, we need something. So this is our dental core committee who share this vision. And I'm so proud of these beautiful individuals because this is my tribe. This is my family. We share that vision and we lead from the heart with passion and embrace our dental skills to make an impact. As you know, a team needs synergy and cohesion. This is Kevil. Kevil is my husband. Now, without him, honestly, he's such a supporter. He is my calm. He's the one on days where I feel like this seems like a big mountain to climb. He's always there saying, nope, we can do it. And his philanthropic nature to me is always inspiring. This is Sham. Sham is our education lead. I call him our professor. He has such a vision because he is creating our dental nursing hygiene therapy syllabus, which, by the way, has been written, and we have had such a pleasure of writing this. And Nilam, she has just recently given an amazing TEDx talk, and she is our strategist, and she's such a powerhouse with great vision. And Binny, who is out leading our fundraising and partnership. So if you are listening today and you're already thinking, how can I get involved? I want to sponsor, I want a partnership with Better Lives Foundation, then you need to get in contact with us because there's a lot of work to do and it's going to be an amazing journey. And this is Rishika. She supports our dental camp initiatives. It's been an honor to serve with her in Sierra Leone. So how did this all start, for us as the dental team, taking this sort of vision bigger? And what is the vision? I can hear you guys saying, and I'm going to share that with you. So lockdown, gosh, COVID, it seems like such a long time ago, and I can't believe what we went through during that time. But as I always say, challenges are an opportunity. And that opportunity brought us together. So these are our volunteers, and we've had so many, join our team. And together, we during COVID would have our regular meetings and we'd say, look, guys, we can't go out right now to do a medical or a dental camp. What can we do? What is the next step? So the next step was this. At the moment in Sierra Leone, our hospital resides, as you know, but around that, we have procured 25 acres of land. And in this 25 acres of land, we want to expand the hospital into a teaching hospital. With that, when it comes to the dental department, we want to create a dental clinic. We have one already, but we want to expand this into a training facility. Constructing the facility, which will help them provide free dental care and education, because we want to be there training the next generation of healthcare professionals so that they are serving their own country, their own people, and creating jobs. You already can see that with our staff there on the ground, that this has been such a lifeline. So I'm going to share with you just a little glimpse of where we started, and a big, big shout out to our friends at Henry Schein, because during that time, we sat there, we were planning this. Frankie, a huge supporter who is at Henry Schein, and her team helped design this dental facility, which will have not only a clinic, but also an education side and an education room with a phantom headroom, a lecture theatre, so that we can be training the next generation of healthcare professionals. Now, I'm hoping by this point you're thinking, that's great, Bijal, I'm sold. How do I get involved? And there's so many ways that you can get involved. So let me break this down for you. So donations. Our charity, our hospital runs on our regular donors. It means that we can have our pharmacy running to be able to provide those medications, our patients who we see on a daily basis. This is a hospital that is running 365 days a year, 24 hours a day. And your donations means that we can actually do that. The other way is partnership and sponsors. This is a huge part of the expansion project. And of course, volunteering. And there's multiple ways that you can volunteer. I'm going to talk you through each section. So, if you want to become a regular contributor, if you go onto our website, you will find on our website, if you go on to hospital expansion, go into the dental teaching hospital and donate to the dental hospital. Here we are gathering funds for the expansion project. Now you can choose to either donate as a one-off or become a regular donor. That might be just sacrificing your coffee that week or that month, but every little honestly really, really helps. And if you are an amazing influencer, like one of our ambassadors here, and you may know her, she has just recently had a fantastic book series released, Jordan Glover. Glover, she is a co-author of our series of a series of books called Wonder Team series. It's written with our very own lioness, Leah Williamson, our England's team captain. Here's what she has to say.
In the past 10 weeks, both of my children have been to hospital. They got better really quickly and their illnesses weren't serious, but I could get them the healthcare they needed because in our country, thanks to the NHS, it's free and our hospitals are easily accessible. But this isn't the case everywhere. In Sierra Leone, healthcare comes with a pretty hefty charge, and even if you can afford it, it can often be a long way to travel to get to a hospital. The Better Lives Foundation are trying really hard to change this. In 2009, they built the Yonibana Hospital, which aims to give free healthcare to everyone who needs it. In fact, Yonibana is the only hospital in Sierra Leone that does offer free healthcare, which makes it a really important centre for communities. Not only that, but they have outreach teams that travel to the surrounding 360 villages, aiming to assess patients and refer them back to the hospital if they need more care. They also sponsor and support those who want to get their own medical qualifications so that they can then provide care locally to their communities. However, with rising costs across the globe, running the hospital is becoming increasingly difficult, and that's where we need you. Even the smallest donation could make a massive difference and keep this hospital running so we can provide free healthcare to those in a country where Actually, sometimes you have to make a decision between feeding your family and getting the care for yourself. If you can afford to donate, please head to the link in my bio, which will take you to the Better Lives Foundation website. Or you can go to Google and type it in there, and the website will pop up straight away. You can also read about some of the amazing work the Better Lives Foundation is doing into Sierra Leone and see for yourself why it's so important that we keep this initiative going. Remember, even the smallest donation can make a massive difference, so thank you so much.
Thank you so much, Jordan. I really appreciate all your support. So, what are the volunteering opportunities? So, we're excited to announce that as we are expanding our team, you have the opportunity to be part of our mission in oral health and educations. Our applications are now open for the following positions: dental educators. So if you are in a university setting, you're a lecturer, you want to be part of our education team, then this will be a role that would be very much suited to you. Fundraising and partnerships, strategists, social media, dental health camp facilitator, as we regularly do go out for our camps. And of course, if you're a dental healthcare professional and you want to come out with us, then please do get in touch. I'm going to now share with you a snippet of our medical camp in November 2023. This was a medical camp that was the first one after COVID. And of course, Sierra Leone was hit by Ebola as well. So during that recovery of it all, this was our first camp, which meant that we needed to see how things were in the dental department, what equipment was still working, what inventory, we had to go through the whole inventory. As the dental director, I have to look at things at large, but I'm also getting it, I also bring a whole team together with their skill sets. I'm going to share with you a little video just to give you an idea of what it's like when you come out with this, what our dental department's like, what the hospital is like. Just a short little video, and then I will share with you the learnings and experience of that camp. Greeting. Now, this is the beauty of Better Lives Foundation. So they provide training, right?
Yeah.
They provide that training. So they know the importance of patient care. You know, that was always the forefront in our dental department, because we deal with a lot of anxious and nervous patients who some of them never seen a dentist.
It's not just a dental unit there. We have a whole hospital.
Hi everyone, this is Yonibana. We're at the Yonibana Sai Hospital. It's 30 degrees today. Really, really, really scorching hot. And this is the hospital as you see it.
And everyone in our team over there, the volunteers, was so invested in it, in learning more and then being part of this. So I think that really helped.
Just get the ground rules of how we need to work so that when a patient comes in, you feel happy that if it was your mom or your dad, you gave them that treatment the way you would your own family members. Okay, so that's what we will do today.
So here you have our documentaries, which you can find on YouTube. It will really give you a really good overview of our experience there. So this camp will always be one very close to my heart. It was the first camp, as I said, after COVID, and we did not know what kind of patient cases, what the need may be like after such a long time. The picture that I'm showing you here is of a 14-year-old boy who came in. I asked him, "Can you please open your mouth?" And this is how much he could open. He had had this facial swelling and dental infection for probably over, gradually happening over the last few months. Can you imagine not knowing why you're having this swelling, suddenly not being able to open your mouth? These are the kind of cases we were seeing. And it broke my heart because we were seeing so many little children who had got used to the feeling of what pus and abscess would taste like. and many of them had not seen a dentist ever in their life. There are often witch doctors there, and they don't have local anesthetic, and there may be a stigma attached to the way dentistry is and what it may mean. So patients come in with a lot of fear and anxiety. Now, our wonderful team there, so the language that is spoke there is Timni, and our wonderful staff and volunteers would translate and share with us the experiences of our patients. Many of them had walked distances that we cannot even fathom to drive, let alone walk in the heat, just because they had heard that a group of dentists are here. The Yonibana Sai Hospital dentists have arrived. There were queues of patients waiting. And these days were long and hard. I'm going to be absolutely honest, they were long and hard. And any time we thought, oh gosh, we're sweating through our scrubs at this point. But any time we had a moment of, oh, I'm tired, no, we looked outside and we could see people waiting there patiently with a heart full of gratitude. And it motivated you to just keep going. The joy that you feel to use your skills, your humanistic values of love and compassion, I can't put into words how fulfilling it is. You wake up the next day, you're absolutely tired, but there's an energy that drives you to want to do more. So I know a lot of you were thinking, well, when is the next camp? So our next camp.
And this is the beauty of Better Lives Foundation.
Our next camp will be April, May next year. There are limited spaces because we've already had such a huge interest. But if you are interested, then please take a picture of this, screenshot this, drop us an email. When it comes to the camp, you're a volunteer and you're coming with us, it is self-funded, but we will accommodate with all the logistics and organize that. And it's such a fantastic experience because we go as a family. The dynamics, the synergy that you feel as a team is amazing. You just have to come out to know what I'm talking about. So, one of the things I was asked to talk about was dentistry, leadership, and purpose. And I was like, I can't put just a slide together. I'm hoping that it oozes out as I give you this presentation. But over my 18 years, nearly 19 years of experiences of multitude of medical and dental camps with different charities, but also being the dental director of Better Lives Foundation, it has helped. I honestly feel doing this has helped me more than I'm giving back. Your character development, your personal development, your inner learnings. It will strengthen you as a person. It will make you a better clinician. As a healthcare professional, we are in such a privilege and honor that every day we get to, in our profession, be kind, compassionate human beings who genuinely want to care and help. But that can often have a toll on us as well. But this will drive you. So for me, as a dental surgeon, for me, having strong conviction and believing in what I do gives me so much joy. It's so fulfilling. We're academics with what we do as well, but nothing will come close to the life experience that you will have when you do work like this. And that's really important. Books can only teach you so much. Life experience will really give you that wholesome experience. I've learned to know the strengths of my team. So you work in cohesion and as one unit. It's never, the classic, we say there's never an I in team, and it's so true because you become a family. And know your tribe, your family will carry you. When you share that vision, it happens. It doesn't feel like hard work. And as I share this with you, I know it feels like, well, how is this going to happen? It will. It does happen. Do you remember that first picture on that barren land? That had a vision, but it happened because of a team, because there was leadership and there was purpose behind it. So being a leader has taught me to be the calm in the storm, to know and have faith that things will, where there is good intention, they will work out. It can often feel like you're climbing a large mountain, but you know what? It is so worth it. When you're there doing that together, that view from the top, the smiles on those faces is worth it. And I strongly believe, and I'm sure you all agree with me, that healthcare is a right for all. It shouldn't just be for a few. Healthcare is a right for all. And I will always strive to be the voice for the voiceless, the strength when there is weakness, and vice versa. This is what community does. Remember, it takes a village to raise a child. Let's be that village. So let's chase those sunsets together. And I put this slide there because these are the sunsets in Sierra Leone. Outside of the dental department, these are the sunsets that we will share together. For any more information, this is our email address, our website details. Please do get in touch. I would just like to say a heartfelt thank you to each one of you who has taken the time in your busy schedule to join us. It means so much. If you do want to reach out, even if it's just to, have a bit more insight, then please get in touch. Thank you so much for joining me. I will now stop sharing my screen, Caesar.